Okay, we are live. We're live now.
Good afternoon, everyone. Thank you for joining the Toronto Seniors Community Housing Quality and Tenant Engagement Meeting for July. I'm Linda Jackson. I'm currently off camera. I'm having a little bit of a technology issue, so I'm just going to start off camera so that you can hear me. I don't want to freeze during my opening remarks. So I want to welcome everyone this afternoon. We have a good attendance this afternoon because we have some wonderful presentations, and I'd like to acknowledge Maureen and Jim, who are members of this committee. And we also have Lawrence D'Souza joining us, and Fareed, our chair, also joining us, and I thank you for joining us this afternoon. As mentioned, we have a very exciting, I did want to mention that if people have looked at the package, there's a slightly updated package that is on the website. There was a few minor changes from the city's presentation. So if you're looking at your package, it might be just slightly different, but it has been uploaded, and I want to thank Karen for doing that for us. As I said, we have an exciting agenda today with two presentations on topics that have been of particular interest to the board and to this committee in particular. Ms. Denise Andrea Campbell, Executive Director, and her team will present on the Toronto Community Crisis Service and the Community Safety Unit Review project for Toronto, which we're excited to hear. And we have actually changed the agenda slightly today to accommodate our city colleagues. So we're going to be starting with those presentations, and then we're going to be going back to approve the minutes. So if you think that we've missed something, we will get to that. But we're going to start with the city. As we start this, I do want to apologize if I have some technology issues. I'm out of town. Some news for me is I have recently retired from full-time work at Unity Health, and so I'm starting a new journey, and I'm very pleased to be continuing with both this board, and I'm the chair of the Regional Geriatric Program Board at Toronto. So I will be continuing to do some work, but I won't be working full time, which is a nice change for me, and I'm very fortunate to be able to do that. At this point, I'd also like to. Yes, I'm starting a new journey, and I'm Are you listening to me?
Sorry, that was just a little background. Go ahead, Linda.
Okay, thank you. We also acknowledge at this point that I would like to do the land acknowledgement. Toronto Seniors Housing acknowledges that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. And we are now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with multiple Mississaugas and Chippewa bands. I'd also like to acknowledge the African Ancestral Acknowledgement. Toronto Senior Housing acknowledges all treaty people, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those who were brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to these ancestors of African origin and descent. We will now proceed to item 3, approval of the public meeting agenda, and I'm pleased to say that all of our items today will be actually in public. We don't have anything in camera, and I'm looking for a motion to approve the public meeting agenda as presented. Thank you, Maureen. A seconder. Jim, all in favor? Thank you very much. At this point, I just want to check if there's any conflicts of interest. Is there any conflicts of interest to declare? I don't have any. Hearing none, there are no conflicts of interest. Next item is the minutes. The minutes of May 29th, and there were several people, Maureen and Jim and Lawrence were all at that meeting. May I have an approval of the minutes of May 29th? Maureen, seconder. Jim, are you okay with the minutes? Thank you. All in favor? Great, and we will actually get to the action items after our first meeting, or our first agenda item. So that be resolved that the May 29th public meetings, minutes of the Toronto Seniors Community Housing are approved. So we're going to move now to our special guests, and I would like to introduce the following people from the City of Toronto. Social Development, Finance, and Administrative team. We have a good team here, and we really, really appreciate it to present. Denise, Andrea Campbell, Executive Director, Nicole Watson, Manager, Mohammed Shirley, Director, Community Safety and Wellbeing, and Celine Malona, Policy Development Officer. And I apologize, Celine, if I got your last name wrong, but we welcome you. Thank you. I'll work on it for next time. And I think I'm going to be putting it over now to Denise, who's going to open it up.
Thank you so very much. It's wonderful to be here. And
Thanks, Denise.
So our first presentation, I think we're just going to dive in. Our first presentation is going to be led by Nicole Watson on the Toronto Community Crisis Service, and then we'll follow that with the review of TCHC Community Safety. So let me just turn it over to Nicole.
Thank you very much, Denise, and good afternoon, everyone. Nice to share the space with you today. We are just going to share a PowerPoint presentation. Thank you, Celine. You may just need to swap. It looks like it's in presenter view.
What?
Okay, we'll try it a second time. And as
Sorry,
Denise,
folks.
oh, no worries, Celine, that's okay.
There we go. There we go. Is that better?
Perfect. Thank you.
Okay.
As Denise mentioned, and as you can see on your screen, I'm going to talk a bit about the Toronto Community Crisis Service with you all today. We can go into the next slide. The Toronto Community Crisis Service is a first-year priority action under SAFETO, which is the City of Toronto's 10-year community safety and well-being plan. And as you may know, SAFETO really looks to reimagine elements of community safety and well-being and shift our paradigm from reliance on reactive emergency response to a culture of proactive prevention. And really, the Toronto Community Crisis Service falls under this, looking at ways to support those experiencing mental health crisis through a new approach. It is a community-led approach. We have community health service partners that deliver the service across Toronto, and the service itself is free, confidential, and available 24/7. The development of the Toronto Community Crisis Service really emerged after sort of the global reckoning and outcry following a series of a number of tragic incidents for individuals experiencing mental health crisis and interactions with law enforcement. We had seen over the last 10 years about a 42% increase in the number of calls around mental health and substance use that Toronto Police Service were receiving. And really, police had become default first responders for mental health crises when we know that this isn't necessarily a best practice in terms of approaches. And that, in fact, having a law enforcement approach response to mental health crises can sometimes create particular service barriers, especially for communities such as the Indigenous, Black, and equity deserving groups. If I could get the next slide. This is really why and how we developed this Made in Toronto approach, which is the Toronto Community Crisis Service. So as you see on the screen now, these are elements of the Toronto Community Crisis Service itself. It is a 24/7 voluntary consent-based service for those who are 16 years and older. The service utilizes a trauma-informed harm reduction approach and a no wrong door approach that allows and leverages multiple intake channels for people to access the service itself. One of the key aspects of the service is the mobile crisis teams. Residents can access the service by calling 211 or 911, and if the call is triaged for a response, mobile crisis teams will be deployed to meet with the person at their location and offer in-the-moment crisis support. as well as post-crisis follow-up, case management, and ongoing service navigation. This is actually offered as part of the Toronto Community Crisis Service for up to 90 days following the initial interaction with the teams. The teams will also perform a 48-hour crisis follow-up call, post-crisis follow-up call, to check in with the service user and see how things are going. A very important aspect of the service is the focus on culturally relevant services and having a referral network on which to connect service users into. We know that Toronto itself is a very diverse city and that often culturally relevant services can be difficult to access or to locate. And so that is something that is particularly taken into consideration in both the development and the implementation of the Toronto Community Crisis Service. We can go to the next slide. I mentioned earlier, but the service itself is delivered in partnership with 4 community partners, and we have our intake and dispatch partner as well. So there are 5, we call them anchor partners, that are part of the delivery of the Toronto Community Crisis Service. You'll see them outlined on our screen. We recently expanded the service citywide as of beginning of July. So it is now available across the city, and I'll get to a map of what that looks like in a moment. But the key partners delivering the service are the Canadian Mental Health Association Toronto branch. They cover North Etobicoke and North York. In Scarborough, we have Taibu Community Health Centre. In Central Toronto and South Etobicoke, it's Guernsey Crisis Centre. And citywide, we now have our Indigenous specific response covered by Two-Spirited People of the First Nations. And I mentioned this already, but we have our intake and dispatch partner, and that's Find Help 211 Central. So individuals can call 211 directly and be connected to the service. Individuals can also call 911 and receive a transfer over to 211 for potential TCCS response. The next slide will outline the map of service delivery. So this is all of the City of Toronto, and you can see it's divided by color into 3 sections. Those are each of the 3 anchor partners. So we have Guernsey Crisis Centre in the lightest green section towards the bottom, as mentioned previously, in the South Etobicoke area in Central Toronto. Scarborough represented in sort of the mid-green color, that's Taibu, and the darker green up at the top is Canadian Mental Health Association. The dotted line throughout the entire map is to represent Two-Spirited People of the First Nation, our Indigenous specific response, which, as I mentioned, is now available citywide. The next slide. We did have a 1-year evaluation report on the service. This took place and looked at information and data collected between March 31st, 2022 and April 30th of 2023. And as you can see here, in that first year of service, we had 6,827 calls for service that were received. Of that, almost 6,000 times the mobile teams were dispatched to respond. At that time, we had more calls coming in through 911. You see 54% here, and 46% were through 211 or in the community. We've actually seen a shift in this percentage, though, as we've moved into citywide implementation. Currently, the majority of our calls are actually coming through the 211 pathway, around 60-ish% when we last checked, and the remainder coming from 911 or in the community. In terms of diverting calls, 78% of the calls that were transferred to TCCS from 911 were handled with no police involvement. We had 8% of our total calls that resulted in visits to hospital emergency departments, and 4% that required other or additional requests for emergency services. I could have the next slide. In terms of connecting people to appropriate supports, 2,407 referrals were made during those on-site visits with service users for follow-up appointments. 1,160 service users accepted the follow-up within 48 hours. We had 56% of service users who agreed to enroll in post-crisis case management and support. And I mentioned earlier the importance of the culturally relevant supports and networks that TCCS is able to provide. So we see here that there were 300 culturally relevant supports that were provided to service users. The majority, 50% of those being Indigenous specific, and those included things like access to ceremony, traditional medicine, and family and kinship care. 20% were Afrocentric, West Indian or Caribbean-centric supports, and those included things like access to culturally appropriate food resources, referrals to Black physicians, and access to culturally specific programming. The next slide takes us into a little bit about what collaborating with the TCCS teams looks like, or what may be involved in that. So TCCS teams work collaboratively with emergency services, including Toronto Police Service and also TCH Special Constables, to ensure that service users receive the best care possible. TCHC Special Constables can actually request TCCS by contacting 911. And then upon arriving on the scene, TCCS will introduce themselves, can provide identification and any necessary information that may be requested. And assuming there are no safety concerns, the team can actually potentially take over the situation and may be able to engage the service user without the presence of the special constables. There are a number of types of calls outlined in our MOU with Toronto Police Service that are eligible for diversion to our teams. And those include calls around thoughts of suicide or self-harm, person in crisis, and well-being checks are the majority of our calls. There's also disorderly behavior, disputes, and advice. So these are all call opportunities where TCCS can be engaged in order to provide supports. If I could have the next slide. In terms of some of the interactions that have happened, TCCS has and continues to provide service to residents of TCHC buildings, including seniors. Really just wanted to share on our screen an incident of that was responded to by TCCS. So I'm going to read it out. The TCCS received a call for service for a resident of TCHC experiencing suicidal ideation, distress, and anxiety. Working in collaboration with TCHC's Special Constables and with Toronto Police Service, the Indigenous Specialist of CMHA Toronto's TCCS team was able to provide de-escalation support and connection to case management, as well as access to Indigenous elders and cultural supports to help the service user continue their healing journey. This is really just one sort of high-level case sample of some of the both the supports that can be provided and the utility of TCCS teams for both seniors and those living in TCHC buildings. We know from our pilot phase that about 557 calls for service, or about 10% of our total calls from year one, were dispatched to TCHC properties. We also know through some of our follow-up data that approximately 11% of users reported being 65 or older at the time. And this is, something that we're considering as we move into year two, and we're engaging in a participant-focused evaluation to hear from some of the service users who have accessed TCCS to learn more about their experiences and ways we can improve the service moving forward. That's actually the end of my presentation. Again, my name is Nicole Watson. I know we are going to have a period of time where I can take questions along with Denise, my colleagues Denise Moe and Celine. So I'll pause here and we'll move into the second portion of our presentation, I believe, but I'll pass it back over to Denise.
Thanks, Nicole. Is it best to wait till the end, do you think, Denise, to get questions?
This is fresh in your minds, actually. So why don't we take questions on this before we add in another component? Does that work for you?
Yeah, I was thinking the exact same thing. Great minds think alike. So that was a great presentation, Nicole, and it's wonderful to see the numbers that you're serving, and thank you for giving us that breakdown of seniors. Does anyone on the call have any questions? Go ahead, Maureen.
Make sure you unmute her.
We'll get Maureen.
She's muted.
Unmute yourself.
There we go. Okay, now I'm here. Yeah, thanks, Linda, and thank you very much, Nicole. That was a great presentation. I'm really glad you're here. You are a sorely needed service, and I'm very happy to hear that you've expanded citywide in July, because we need you here in the East End as well. So yeah, glad I'm happy to hear what you're doing. It's great work. I have some questions around follow-ups. You've stated that you have these regional partners. Now, when you're on site in a crisis situation and you know different agencies that provide different services, how many of the mid-level agencies are you connecting with? Does that make sense, that question? They're not you can't wait until morning for your major partner to show up. I know Gerstein covering that much ground is that they're spread so thin already. How do you know who else to call in? Are there interagency connections there? Does that make sense? Because the
Yes.
follow-up chain has to go back the same way. So I'm wondering how that works.
Yes, absolutely. I can speak a little bit to that. So all of our community partners, so Gerstein Crisis Center, Taibu, CMHA, and Two-Spirited People of the First Nation have a full network of organizations they are connected with in those various regions in order to provide that sort of quick referral pathway. We also know we are tracking this, but currently in our one-year evaluation, it took about 25 minutes on average for teams to be able to arrive on site. So our response times were, not too long in that case, and that's something we're continuing to track. Once they're on site, the teams assess the situation and the supports that might be needed by the individual, and then they're able to refer out through those network partners. So there are a number of smaller organizations, larger organizations, and different specialties within that, as well as different types of care teams that are available.
Okay. And they all work with you at the moment, or?
Yes, they all are connected into that network of support, and that's really part of the success of TCCS is being able to capitalize and leverage on those available services.
Yeah. Okay. And follow up, of course, being a big piece that's always kind of left blowing in the wind. You track backwards along those same paths of service providers?
Yes, so there are a number of service users who will go on to receive additional services, and we do look at, we are trying to gather more information on what are the main referral pathways that are used and what are the services that are most commonly referred to. And that's something we hope to have more information on as we move into the second year evaluation.
Yeah. Thanks. And one more question. You talked about tracking 11% of your calls were 55 and plus in age. That's almost another culturally sensitive area that needs to be looked at. Do you have seniors agencies or specialists that are connected within these networks?
Yeah, such a good question. So that is, we do have some organizations as part of the networks that focus and specialize on support seniors. We also, as part of the training that all of the teams include, there is some training specifically to family and kinship support, and that includes providing care to seniors. But you are absolutely right. That is sort of another focus area of concern in terms of how can we ensure that we are leveraging and amplifying service delivery to seniors in the way they need. And I think that's something we can explore further as well as we build things out.
Thanks very much. Great work.
Thank you.
Thanks, Maureen.
Thank you.
Those are great questions. I agree. Jim, go ahead.
It was a great presentation, Nicole. Thank you. And I just wanted to say that I'm really glad to see that we're partnering with this agency. I worked at Gerstein Center for, I was there for 3 years doing follow-up calls to clients to see if they need further referrals and just to accessing how well they were doing after leaving Gerstein. So I'm really glad to see that it's expanded across the city and going to be widely available. And thanks for the presentation. It was great.
Thank you.
Thanks, Jim. And maybe I'll, Free, did you want to ask a question? And then I have a quick one too.
Yeah, thanks, Linda. Just to echo the sentiments expressed by Maureen and Jim, great presentation. I guess my question has to do with what can we do as the Toronto Seniors Housing Corporation, because I see all the reference to the Toronto Community Housing Corporation. What can we do to support this initiative? Are there things that we can do in our buildings? Are there information that we can provide to our tenants how can we create that heightened sense of awareness? And I guess my second issue is I didn't hear much about challenges, and I was wondering, I mean, what are some of the challenges and that you would have experienced as you rolled this out, and maybe reflect a bit about that, because I'm sure, whether it's ability to respond to clients within the service level timeline that you set yourselves, whether it's resources that's required, whether it's personal adaptability. I just want to sort of get some feedback or comments about the challenges that you may face as you implement and roll this out.
Yes, thank you. Maybe I can start and then I can always invite Mo or Denise to add in. In terms of what, how we could interact more with the committee or things that we might want to look at jointly working on together, we do currently have some areas where we're engaging with the special constable units. We've done presentations, but I think just sharing awareness of the service as a resource is one of the key pieces, and also sharing that through all of your networks as well. We are just sort of in the soft launch citywide phase. We will be doing a more official launch event and public awareness campaign in the fall to get word out. But I think that is one of sort of the key areas of need currently, is just increasing public awareness of the service. And in terms of challenges, there have been a number of challenges we've come up against. I think one of the main pieces is just ensuring that there are services available to refer clients to in a timely manner. And this is part of ongoing conversations, but looking at ways that we can supplement and support the mental health infrastructure within Toronto, and that infrastructure that surrounds the service is really a key area of our focus in order to be able to provide those referral pathways and to ensure that service users are able to receive the follow-up supports they need. We really need to make sure that surrounding infrastructure is properly resourced and supported. But maybe I'll also see if Mo or Denise had anything to add to that.
Sorry, just unmuting myself. I think one other thing to add in terms of Cole's answer is that we are also, our community anchor partners do outreach and presentation. So if a value, we can certainly have them attend any presentations or do any outreach in any of your buildings. So, and Nicole can help facilitate that. So that's a really key component. But Nicole really touched on one of the challenges, which is the mental health system is fragmented, unfortunately, and some of the needs upstream for crisis beds, counseling supports, long-term supports are just simply not there. And that is something that we are advocating and trying our best to work with the provincial government, particularly the Ministry of Health, to underline. And under the Mayor Chow's leadership, she has been consistently pointing that out, that it is provincial responsibility. And I think the other challenge is we're starting to see complex needs, individuals with complex needs with multiple concurrent issues. So, that might mean experiencing homelessness, but also going through a particular mental health challenge, while at the same time having lack of family or interpersonal supports. So these sort of supports for these individuals are not an overnight thing. These take time. Our service is a consent-based service, so we walk alongside the individual, and we try to provide our best support, gain their trust, and help open doors for them, and that takes some time.
Great, thank you. I don't know, Denise, if you wanted to add anything. I had a quick question, and it's always my worry when things are in evaluation stage, that this is, in my opinion, the service has been needed for a long time, and you've got some great partners. Is there any risk that and it sounds like the evaluation to date has shown that it's been very positive. Is there risk in terms of it continuing to be funded, and any threats in that? And my second little piece is, I assume that you're also working closely with the Ontario Health teams in the different areas as well. Because that's, mental health is at the forefront of all of those as well.
So I'm so glad you raised that question, because I know from the beginning of our journey on this, and when we first started, council gave us our direction to first pilot this. that there was both the, oh my goodness, this is so needed, thank you, and the deep fear that this was going to be just a moment. So I'm happy to report to you that there is no risk. In November of this past year, council designated this as the 4th emergency service. So we had a vision that this was, we were building, I'm going to say institution in quotes because it's a very community based care model, but we are building an institution just like fire, police, paramedics. And the goal here is to have this be a service that is the same kind of quality and consistency that residents can expect and experience in their most time of vulnerability and need. And so City Council has stepped up and provided all the funding needed in order to build out and expand. And then to Mo's point, our continued advocacy is about rounding out the ecosystem. But this is now not a pilot, it's not a program, it's the 4th emergency service, and it will be here for generations to come as long as it's required.
That's great, Denise. Thank you. I see Tom's hand up, and I see everybody feeling good about that. Tom, did you want to add something?
Just quickly, I just wanted to, first of all, commend, Denise, the team. I mean, I think just even philosophically, this is just a significant shift, and I just are really excited about this, this service for the tenants and the citizens, and I think what it can ultimately even mean how we look at all aspects around delivery around mental health and crisis. But just want to assure the board that our complex tenancy team has been working with the Toronto Community Crisis Service. So we are, as the pilot was rolling out, we were involved with them, with some of our tenants. And so that's a really good start. And so glad to see it now will be across the entire city. And then I think to earlier points, we certainly can work offline around, as this is announced further in the fall, how we ensure that gets out to our buildings, but also ensuring that our key staff are aware of this service, and it becomes really part of our toolbox as well for helping to support our tenants. So just wanted to, kind of share that information.
Thanks, Tom. That's great. What a great resource. And we may come back to you so to get more advice on how to have these effective collaborations, because that's it's key. And I know that that's actually a big focus of Arlene and the team as well from TCSC. How about I think at this point, if there's no other questions, maybe we could move on to the CSU review, and I'll pass it over to you again.
Thank so much. And one quick thing to close that off, you had asked me about the Ontario Health Teams, and in my enthusiasm, I forgot to say that yes, our anchor partners are connected, working with them. So know that connection exists. Okay, so we're going to jump to another part, the Community Safety Unit Review. That Social Development Division is also leading. And so I'm going to ask our colleague Celine to bring up the deck. Beautiful. So thank you very much for creating this opportunity to walk you through this review. As we have been building it, we've had the opportunity to work with Tom, and he certainly wanted to ensure that the Senior Housing Corporation understood what this review is about and certainly had a voice in shaping where we ended up. So we're going to take that moment to walk you through, Mo and I. As I'm doing that, one of the things I want to ground you in is social developments are mandate at the city. So we lead transformative change. You can go back, Celine. We lead transformative change policy and services to create a safer, more equitable and just city for all residents. So as you just saw in the Toronto Community Crisis Service, we often are mandated to innovate, understand systems, needs, gaps, and to innovate in order to drive equity and change across the organization. So what I want to do is Mo and I are going to quickly walk you through the review. We want to talk a little bit about the mandate and context for the review of Toronto Community Housing Safety Unit, where we are in terms of phase 1 engagement and the progress that we're making on there. And then walk you through what we're doing in terms of phase 2 engagement. Next slide, please. So in order to move forward, I want to take us back to briefly touch on the beginning of this work. So the TCHC board had been working for some time to secure this review. As you can see in front of you, item EX 17.2, so City Council speak, implementing Tenant's first 2020 action updates in the year 2020. That is where the first directions came to review the community safety unit and function of TCHC. It was then later affirmed in 2021 through a mandate direction, which City Council approved. So first the board and then City Council. And then it took us a little bit of time as we were ending the pandemic. Well, we weren't ending, as the pandemic was ending, in order for us to really get the review underway. But we begun working with the Community Safety Advisory Subcommittee of TCHC's board in order to develop the terms of reference, the process, and understand the context for review. We developed a background document working with the board members and CSAC, as that subcommittee is called. We created draft themes and focus areas that begun to align the work. Next slide, please. So the CSU review is guided by 7 principles developed through key stakeholder interviews and solidified in terms of reference that was then supported by that subcommittee of TCHC's board, CSAC. It was agreed upon that the CSU review needed to encourage courageous, transparent, and reciprocal conversations among relevant stakeholders. It needed to take a holistic, collaborative, and systemic approach focused on synthesizing diverse insights, data, knowledge, and lived experience. It had to intentionally create opportunities for relevant stakeholders to reflect on past practice, past approaches, and decision-making, and that the review needed to pay attention to ensuring that the diverse lived experience and quality of life of tenants is centered and prioritized within the review. And that the review, in the process, the analysis and the recommendations that we create are grounded in a commitment to reconciliation, confronting anti-Black racism, equity, and center a rights-based approach to the overall review. And next slide, please. So this review is being advanced in the context of significant changes in how the City of Toronto is understanding and conceiving of community safety and well-being, especially when we look at Indigenous and equity-deserving populations and people living in poverty. So just as we saw in the reimagining of how we support mental health through the Toronto Community Crisis Service, this review is happening in that same context. So Toronto Police Service data released highlighting disproportionate use of force, especially on racialized people, especially Black people. City Council's 36 decisions aimed at advancing policing reform in June 2020, and their adoption of SAFE-TO, Toronto's Community Safety and Wellbeing Plan, in July 2021. The efforts of my division to advance alternative approaches to community safety and well-being, especially through things like the Toronto Community Crisis Service and Toronto Community Housing Corporation's establishment of the Centre for the Advancement of the Interests of Black Peoples and their work to advance actions related to the CSU are all part of what we've understood from speaking to key stakeholders in the TCH system were important as driving a review of the CSU at this time. Next slide, please. So just before I turn it over to Mo, from a content perspective, through our initial document and policy review and some key informant interviews with TCHC staff, we have worked with our consultant partner, ConveneTO, to develop the CSU review plan, work plan, and we've worked through the TCHC system of approval to have this work plan approved last November. So the scope of the work for the review includes review of historical decision-making in TCHC around a change in model of how they provided safety and support, the growth of the CSU, and its effectiveness, looking at TCHC violence reduction initiatives, approaches and policies, looking at tenant experience and their perception of safety, also looking at the City of Toronto approaches to community safety and well-being. One of the other things that's been important is that in this work with TCHC leadership, we're also integrating a Black CSU employee review that is focused on understanding the Black CSU employee experience, including hiring and promoting decisions that has also shaped the way in which TCHC's CSU, there's so many acronyms, Community Safety Unit is functioning, and any recommendations that our consultants and the city will make about how to improve it. Let me hand it over to Mo for the next slide.
Thank you, Denise. So this slide, we just wanted to give a high-level overview of the work done to date. So between January and July, when the consultants have come on board, a large focus has really been around discussions with TCHC tenants, and we'll talk a little bit more about those consultations and engagement. Significant review of data and looking at the data and historical documentation to understand the role of community safety unit in TCHC, how it came about as well. And some of the key decision points along the time, as well as engagement with the CSU staff themselves. Along the way, we have been updating the TCHC CSAC committee, as well as incorporating, as Denise mentioned, one component, which is the Black CSU employee life cycle part of the review. Going forward from August to November, we're going to be with our consultant finalizing and developing insights and recommendations, as well as working towards a report to be delivered to Toronto City Council's Executive Committee, but also to the TCHC board. And I can talk a little bit more about that reporting structure in a second. Have the next slide, please. So in terms of the engagement at a high level, to date, there's been around approximately 38 interviews conducted, and they've sort of been bucketed in the following ways. We've had interviews with external agencies, so social service providers around mental health, community workers, TTC, and others who may have special constables and or interactions with TCHC. Certainly, there's been extensive engagement with TCHC, tenants, board members, staff, including engagement with seniors tenants group. And then there's been engagement with City of Toronto proper divisions and groups, such as our division, Social Development Finance, but also the Housing Secretary and other relevant divisions. We've also had a focused conversation on equity deserving communities, but also reconciliation focus in terms of Indigenous communities, with a focus on 4 focus groups right now, 2 LGBTQ tenants, Black residents, and people with disabilities, with enhanced engagement with these particular groups. Can I have the next slide, please? So in terms of our going forward engagement, our consultant will continue to do the engagement and interviews with TCHC staff, as well as Toronto Police Services, which has a role to play in terms of safety and engagement with the CSU overall. We'll also have a continued ongoing focus group conversations with tenant groups, as well as specifically Black youth, as well as seniors. And then there'll be continued data analysis in terms of reviewing historical documentation like call volumes for the CSU, call types, dispatch data, and many other things. This is all culminating into the next slide, which is sort of our high-level timelines, and this is our last slide, which really highlights that we've had ongoing briefings along the way, but we're working towards essentially the last 2 bullet points. A final report that the consultant will be delivering to City of Toronto in October, and our work towards a report back to Toronto City Council through the Executive Committee, but also the TCHC Board, with a date to be determined in the early fall. And maybe I can stop there and we can take some questions.
Great, thank you. Thank you very much. That was comprehensive. I guess that I do understand that CSU, they're employees of TCHC. I just wonder if there's anything like how the report will go specifically back to this corporation, and just just maybe. It would be great if in the presentations there was kind of reference to Toronto Seniors Community Housing as well, because I think that the seniors in particular have a voice in this. I do see that your focus groups have included seniors, but maybe you could comment about that.
Yeah, so I really appreciate the question, as that I noted at the outset. It was very helpful starting this journey, and having Tom in his other role, a temporary role, because one of the things he brought to our attention was the need for us to ensure that we not only came to talk to you, but that we were also having the consultants do some engagement with some of your seniors, and then so that we can be mindful around how to take your perspectives within this overall review. So I can't say at this point exactly how and when we will be able to come back, but we will be able to come back. I think right now the key directions hold us to the TCHC board and to City Council, but understanding that you're part of this ecosystem, we can absolutely come back to you to provide you with an update as to the outcomes of the review as well. And as I noted, making sure that some of your tenants and staff are engaged in the consultation process to feed the recommendations that will be core to our reports.
Thanks, Denise. That's helpful. Maureen? Oh, it looks like you flipped back to being on mute, Maureen.
Just want to thank Tom for making sure that this presentation came to us, because we were unaware, well, I was unaware that this work was being done at all. And you're really establishing a good solid base for what to base this review on, or where to go from here, which is great. And I really like the line you used was perception of safety. And that's where it could be different, well, different for all different people. Definitely some difference there for seniors. You know, what do they perceive is safe and not? Because as their abilities lessen, their perceptions of safety are going to change. And where does it go from October? What happens then?
So this is an iterative for sure, but essentially when the consultants convene TO, give us their final report in October, then it's up to the city staff team to determine what of those recommendations and overall analysis we will be advancing as staff recommendations to the process. And essentially, we've got two things that we must do. One is that we must report to the TCHC board as the instigator for the review, and that we must also report to city council, executive and city council as well. So that's what happens next. I imagine that given the amount of tenant and community engagement, one of the other things will be creating a communications strategy as well to update all those who contributed and those who may not have been in the consultation, but certainly have a vested interest in what happens next. And then it will be up to the TCHC board and the new leader to how they will interpret our recommendations and then create a plan for implementation moving forward.
Okay, what if they don't want to implement them?
So that's a very good question. It's a very good question. So I think part of this process has been the iterative nature has been we trying to build momentum and support at the leadership level and the staff level along the way. So part of our frequent visits, for example, to the CSAC, the subcommittee that the board set up to support this review, part of our ongoing conversations with the new CEO, as well as Councillor Fletcher and the mayor, is to build support for what will come forward.
Gotcha.
And I would like to believe that because this is a well done process, that the recommendations will be.
The willingness might be there more. Yeah,
That's right.
got it. Thank you.
Thanks, Maureen. Gee, we asked the tough questions. Tom, did you want to add in? And we do appreciate, I would say, Tom, that you have been helpful in bridging over to the senior side.
Yes, through the chair, thanks, Lyndon. Just to the committee, just want to mention that in terms of our contribution to the process, I think it was mentioned that there was a focus group done with the stack, but also early in the process, Grant and Brad were interviewed as part of this. And also don't forget that, there's 17,000 seniors in Toronto community housing. And when the consultant was with Stack, he really assured us that there was really good input from seniors, from the Toronto community housing side, and their impact as well. Because we hear things just about timing, but also about when you look at the diversity of our tenants and the large number that English is not their first language, this whole even ability to communicate around how they will be supported by CSU. That's something kind of, I think, with seniors that we really want to focus on. But and also from a scope perspective, we are starting to understand some work that we've been doing, that we roughly we're using about 10%. We're like 10% of the call volume from the community safety unit. So that just gives us a bit of an idea about where we are there. So, it is a smaller percentage, but certainly kind of significant. And we know that this is a number one priority of our tenants. And we also shared with the consultant the results of the quality improvement project around tenant safety and the recommendations that were made there. So, there has been input, and we are anxiously awaiting the results of the review, because I do think it just is generally really felt very strongly that it's always about continuous improvement and around community safety. There are improvements that we need to be made in the safety and security space in our building. So we will be watching carefully and certainly kind of supporting and implementing what needs to be.
That's great. Thanks, Tom. And I think we'll have your back there, Denise, if there's a problem with getting it forward. I think you've got another group of people that will be a loud group that will be here. I know that some of our city folks have to had another meeting. So if there aren't any other questions, I'll just ask if there's any other quick questions. Yes, Jim?
Oh, I think, Jim, you're on mute. Yeah.
I'm on mute too. Jim, you're on mute.
That's
You're good now. Oh, you flipped on and off. Oh, we can't hear you, Jim.
it wouldn't unmute.
There you go.
Came up, a bubble clicked up to the right-hand side here saying, do you want to unmute? Yes, I do. I just wanted to, following up what Tom was saying, is that when we were having discussions with STAT concerning the fast tracking the homeless, one of their concerns, major concerns, was about supports for people using substances. And I believe that this is going to address those worries that people had. This is something that we really need, I think, going forward, is being able to respond and get help for people who are going through mental health crisis. Thanks.
Thanks, Jim. So we've got our support, Denise and team, and I just want to actually take this opportunity to thank you and your team for coming, Nicole, Celine, Mo, and Denise for presenting, and you're welcome to come back anytime.
Well, we definitely will take you up on that invitation with the outcomes of the review. And as we noted earlier, really look forward to how the crisis service can increase awareness within your spaces and collaboration so your tenants can access this important new addition to the city. So thank you very much for this space and opportunity.
Thanks again.
Take care.
And we'll let that group go. All right, we are going to move to the next agenda item, and I have a clock behind me. That's me. I'm trying to turn it off. We're going to move now to the action item, back to the action item. And that's from our last meeting in May. And there was more action items this time, I think, than previously. I think there's only one that's still in progress. And any questions or comments from Grant or Brad around the, and I think there's an Arlene one, but thank you for the follow-up on the action items. Any questions? I think there's one in progress, but around the audits of the safety units. All right, so hearing none, we'll move on to our next item. I think that's for information. So I don't think we have to have an approval. You want to say something, Grant?
Just going to say we are working with the CSU on the audit item, and in terms of a specific schedule for the entire year, that may not be something we can actually provide with specific dates. However, we will continue to work with them. I think we do know which buildings are scheduled. But when exactly, that is something that I think they actually do a little bit, as they go through the course of the year. So we'll see what level of detail we can get. I know that's your item, Brad. I'm speaking to your item. Sorry, if you wanted to add anything. I just realized I'm speaking to your item. Sorry.
That's okay. We see you as a team, Brad and Grant. So yeah. So I think we can continue to provide information as we have it. All right, so we will move on to the next item that was for information, and that's our CEO update, and I'll pass it over to Tom.
Through the chair to the committee, and I do have a few items for today that I wanted to go through with the agenda and what was on the agenda. We thought this might be an opportunity for just some updates. They're relatively quick, but just to several areas, and certainly then any questions that the committee might have would be pleased to answer. But one of the items that we wanted to bring the committee up to date on was OACH and the work with the rent bank. And so we worked with the city and OACH to implement recent changes to the Toronto Rent Bank program that TSHC tenants receiving RGI are now eligible by working with OACH. So previously being an RGI tenant disqualified them from qualifying for the Toronto Rent Bank. So this is good news that they can qualify. And this program provides arrears relief to residents, and we look forward to the next OACH report to the committee with updates on the number of residents who have been able to have their housing stabilized as a result of the Toronto Rent Bank program. So good news in that area. And also for this committee is aware, but is our work with RPath, and we're pleased that Brad Grant and myself we attended the RPath, their anniversary celebration on July 18th. It was their 11th anniversary celebration. And just to remind RPath is the Responsible Personal Accessibility in Toronto Housing Committee. And it's been resident-led, and it has been resident-led since 2013. And really the focus of that group is to improve the quality of life for people with physical disabilities, to support Toronto community and Toronto seniors housing, and really being a lead in accessibility. As you go to our buildings, you can certainly, in many of them, see the exemplary work that this committee has done in helping to inform accessibility. And so we are actively involved with that RPath group, and you're really pleased with what we're seeing in our buildings. Also, just wanting to update a bit to this group on STAC, right, the Seniors Tenant Advisory Committee, and they really continue to provide such valuable input into the work that we're doing. Most recently, it's been around the use of space policy and the draft tenant code of conduct that was developed at the implementation table, but then taken to STAC. And also, as you heard in the last presentation, that they were involved with a focus group around the CSU. And in our July meeting, their new terms of reference were passed, and the terms were revised between staff and representative of STAC. And the new terms create what we see as a stronger link to the Community Connect Plus citywide circle, which contemplates the STAC membership and its 24 volunteers. So there continues to be very good work with the STAC. And with that, I'll just mention that this week and past week, we have been running the regional tenant volunteer meeting. So this is really neat. Now with we have our two tenant board members, we have our representation with STAC, and we now have our regional tenant volunteer meetings. And these are our tenant volunteers from our buildings who now meet regionally. And we've had 3 out of 4 sessions over the past 2 weeks, and there was another set held earlier in the year. And I had the chance to go to these and make some opening comments before then the staff get into the work with the tenants. With, for example, the tenant, the human rights complaints policy, providing feedback in these areas. So it's really dynamic with these groups and these interactions at these regional meetings. So really pleased to see that tenant involvement really kind of now at all across the different kind of levels of the organization. And then wanting to just mention the annual unit inspections, right? That's part of that operational work that just keeps, that happens year over year. And those are now in process, in full swing, and they will be concluded by the fall of 2024. So really good from an operational perspective that we stay on that. And just reminding this committee that for the fall, we're working to put together really kind of a comprehensive review around partnerships, and this was requested at the board meeting. But we just know that there's a lot kind of that's happening in this partnership space, not only from a housing perspective, but shelter and wellness. And so we really want to bring a presentation and a time to share information around this partnership for the committee and the board in September. So stay tuned on that one. And then just finally mentioning with the Toronto Seniors Annual General Meeting, the package was approved at this board in April. It was adopted through the city's executive committee on July 16th and is being considered by council this week. So we are anticipating there could be a motion to our annual general report around kind of reporting on the integrated service model, and that that will be a chance for us to kind of highlight what has been happening. So those are, I know that's quite a few updates, but I do think they just really help to share with this group just the work that has been happening in that tenant space.
Thanks.
That's it.
A quick question, if you can let us know when council has reviewed that annual report, if there's any feedback, that would be great.
Yes. Absolutely, yeah, we'll do.
Thank you for the report. Any questions to Tom?
Sorry, Tom, did you say when you were going to review that?
Review.
When it's going to council, you mean, Maureen?
Oh,
Yeah.
so council is Wednesday, Thursday, and Friday. So we're hoping Wednesday. Might be Thursday. Sure hope it's not Friday.
Okay, thanks.
The agenda can move at different pace.
Yeah, great. Thanks, thanks, Tom, and thanks again for also bridging those really good reports today. I think that was really helpful. So, thank you. And so we'll move on to the next item, which is our operational dashboard. And we're getting familiar with this because we see it every updates every quarter. And I'm going to pass this one over to, I think, Brad, who's going to just address any questions and maybe go through some of the highlights.
Yeah, thanks, Linda. Can we go to the next slide? So this slide shows the overall metrics with some of the things that we track with regards to arrears and vacancy, pest management, and administrative tickets. Then the following slide gives a little more detail on the rent collection rates. The one thing I would like to say is that June is the first month where we have trended in a positive direction. We actually collected 102% of our rent roll, which means we collected more rent than what we charged out for the month. We see this as a positive trend. One of the things that we've kind of been discussing is that by the time we get tenants through the process and can apply for a date, either at the landlord-tenant board or get them into a mediated agreement, awaiting those dates is often 12 to 18 months. So we're now seeing the fruits of the labor that we invested in accounts over a year ago, as far as being put into mediated agreements. So we see that as a trend that's going to continue, as well as Tom spoke about, the deal that we have with the rent bank through the Commissioner of Housing's office that allows RGI tenants to now take advantage of that program sponsored by the City of Toronto. Next slide. Gives an overview of our vacancies, where our vacancies are at. Our vacancy rate stays relatively low. We're at that 1.5%. I don't see us trending any further than that. We generally have 100 units that are vacated every month, with 60 days to turn around a unit and get somebody new in. 200 units being vacant is about as low as we're probably going to be able to go. It's all about maintaining this now and the effect that has on the centralized wait list, as well as our rent roll that provides additional income to support other things. Next slide. Breakdown of our performance with regards to work orders, our completion rate, staff completing work orders at over 93% by the end of the month, and 82% in one day. The categories on the right provide the committee, with a breakdown as to where these are coming from. You can see that overwhelmingly 58% of the contracted work orders relate to pest control and dealing with pest infestations, as well as just doing block treatments and ensuring that tenants receive the treatments that they need in a timely manner. Next slide. This is the tickets, the administrative side of the business that we deal with in the operations. 36% of these administrative requests that we're dealing with are assistance with the annual review process and ensuring that tenants maintain their RGI eligibility. as well as document requests. And 56% of the administrative tickets are being completed by the senior services coordinators, which are the frontline in building staff that are there to support tenants and ensure that they receive referrals and support in maintaining their housing. Next slide. This slide relates to our pest control. We had an increase of 232 units that were declared pest-free. We continue to work with Toronto Public Health, as well as we have a limited resources in helping residents prepare for pest treatments. The last board meeting, we received the tenant survey. One of the areas to focus on was people had issue with some of the treatments and preparing for the pest control treatments. And we continue to make it a priority to try and assist tenants with that process. It's more important to invest the resources to ensure that they're pest-free and those pests aren't migrating throughout the buildings than to worry about how they get prepared for those treatments. That's the operational dashboard. If anybody has any questions, happy to address.
Thanks, Brad. I'll pass it over to Maureen. Oh, you're on mute, Maureen.
Here we go. Thanks, Linda. Hi, Brad. Did you just say it's more, what was the last thing you just said? It's more important to make sure they don't migrate than it is to make sure that it's prepared for?
Yeah, through the chair. We know through the tenant survey that tenants have trouble. And to be honest with you, it's a really engaging, a tenant has to be engaged in order to properly prepare for pest control.
Right.
So we've taken the attitude that it's more important for us to help them and facilitate and get them prepared to help facilitate that treatment than to allow those pests to migrate to other units because a resident's not able to prepare themselves properly for the treatment. And that's why we use our limited resources as well as we continue to grow our partnership with Toronto Public Health, who supports tenant preparation.
Okay, yeah, I know we've been limited in that area for a very long time, so I'm glad you're still working on growing that. Back to my favorite topic, slide 37, the administrative ticket assignments and the role of the senior service coordinator. When our new model became, when we went into the integrated service model, the senior service coordinator was our poster child. That was the one that was going to develop all of the trust with the tenants. They were going to be the front facing, the new and improved staffing, and they were going to be the ones that connected seniors to services that they need. And as you know, and I'm sure for many, many reasons, that referral role has, and this building trust and upfront has just slipped away like a wave. And now they're helping people to, I know they were supposed to be helping people with rent reviews and gathering documents, but that was a smaller part of their job. Right now, they're just assistants, or they seem like they're assistants to the TSAs. And it saddens me to see the change and the diminishing of the importance of that role as a trusting, referring, and very present person, because that's not what it's turning out to be. There's 1,872 tickets. 56% of them went to the senior service coordinator. That's approximately 1,000. There's still no mention here of how many referrals to different health agencies or health services that they've been able to provide for tenants. And we really need to keep looking at that position and stop it from eroding. So I know you're not the only one responsible for this, but it's important, so I'm bringing it up. That's it. Well, actually, one other question.
Maureen, can I see if there's a response to that? Was a really important issue that you raised.
It is important.
I wonder, Tom or Arlene or anyone, if there's any comments around that position, and also the request that you had in terms of referrals to agency, like if there was some way to track that.
That's the individual referrals.
Yeah, no, which I get. Any comments around Maureen's concern about that position? I'm not sure that I've been as familiar with the erosion that Maureen is talking about, or what we're doing.
Yeah, through the chair. I think it's important to note that there's other ways that the SSCs are invaluable to the tenants as they continue to build relationships. And just to point out some of them that we can measure, and it's really difficult to measure the SSC and their effectiveness in the building because we're not part of the circle of care. So oftentimes, once we make the referral, we then lose oversight as to whether the referral was accepted or what services were provided, unless the tenant wants to disclose that to the SSC themselves. It's very, it's something that we're working on, which is more of a metric for that. And we're looking at including more information with regards to the work that the complex tenancies SSCs do, because they're a little more hands-on in the referral space, and we'll be tightening up that reporting moving forward. I would say that the SSCs, Maureen, are invaluable. When I look at some of the differences that we've made this year, we started a year and a half ago with 3,000 outstanding rent reviews, which represented 3,000 tenants that were at risk of losing their rent geared to income status through different sorts of means, right? Maybe they didn't apply for their pension, they weren't receiving gains, they weren't able to properly file their taxes. The SSCs work with them in those things, getting them to tax clinics, getting them referrals for things like that. Yeah. And we've gone from 3,000 2 years ago down to just over 800 outstanding rent reviews, and only 10 of them are more than 12 months old. I know it's not the role that it was intended to be, but when you look at some of the other ways that the SSCs have helped stabilize tenancies, you can definitely see that they're building that rapport with tenants, and we'll look to bring some additional reporting with regards to the complex tenancies team to the committee in the future.
And I think part of the problem is, as you'd mentioned just earlier, that where are they? Where's the data on them collected? Because they're in operations, and yet they're also part of the care team. So that has to be figured out.
Thanks for those comments. I think Tom wanted to respond, and then I'll come back to you, Maureen, because I think you had another question.
Thanks, Brett.
Tom, did you want to add anything?
I do, and I think, like, Maureen, really appreciate that perspective on the senior service coordinator role. And so, you know, we're now, I guess, like, essentially kind of 2 years plus, right, into that role. And I think as we talk about kind of continuous quality improvement or continuous change, I think it is a good point for us to kind of to check in on that role. And what you're saying is, what I see is when I go to the buildings and there's a strong, senior service coordinators, when they introduce staff, often like they cheer for the senior services coordinator because of the support that they get from that individual. That's not a quantitative value, but that's something kind of qualitative that I can see. And so I know these roles, like the senior service coordinator role, does play out different ways in different buildings. And so I think it is a good point to kind of check in on that at this point, but also to your point, I think, what are we measuring, right? So it is an operational aspect, and it was a resource that the city did invest. And so I think, we can take away how, what is possible or feasible around how we quantify, of that work and confirm how we best want it to evolve in the future to the next phase.
Thanks, Tom.
Thanks.
Giving us
Thank you very much.
Did you have another question, Maureen?
Yeah, I just was curious. Why would we? I'm surprised. Okay, we have this. This is slide 35, the vacant unit status, and there's a section there which isn't that big. It's 23 units on hold for rapid rehousing. I'm surprised that we would have to have anything on hold for rapid rehousing. A, I would think the demand would be large. And B, I didn't know we were holding units back from the centralized wait list to do this. So can you give me a little bit of more information on that?
Yeah, sure. Through the chair. So the rapid rehousing program, what we do is every month we look at a number of units that are vacant. We've had a commitment that we made to the City of Toronto with regards to providing them units throughout the year, and that's a rotating number. So June the 1st, we would have advised them that we have 23 units to get to our allocation for the year. And then over the month of June, they rent those units out. So it's not the same units month after month. It's just how we're allocating the units based on our vacancies to them. One of the things that we strive for in the rapid rehousing program that we've had a lot of success is making sure that we're not constantly sending them the same buildings. We're not loading buildings up with rapid rehousing clients, that we're spreading them out so they really do get integrated into their communities.
Yeah. And once you report those vacancies are there, do they get filled quickly?
Through the chair, yeah. The rapid rehousing team at the city generally fills vacancies within 20 days.
Great, thanks.
Thanks, Maureen, for being for really looking at those reports closely. Your questions are always really helpful. Lawrence?
Thank you, Madam Chair. Brad, how do we compile this data? Do you use any specific software?
Yeah, through the chair. So all the housing data, all the tenancy management data is held within the Homes software platform, which is part of Yardi. So there's two major pieces of software that are used in the industry, and TCHC and TSHC use Yardi. What we're doing is we're actually transitioning our reporting to a Power BI system, and we're going to be reporting it through Microsoft Power BI. The reason that we're doing that is that right now the reporting is often manual. We take Excel sheets, we have to export them at a certain point in time to use the same data month after month, and then we have to filter those and put them into the reports that you see. The Power BI solution allows us to all be automated, which frees up staff's time to look at other things and allow us to make data-driven decisions as opposed to preparing reports over and over again.
Okay, thank you.
Thanks, Lawrence. I had a quick question about that too. Do we benchmark with TCHC? I'm very impressed by our numbers, and I know it's not a competition, but I just wonder if we're actually benchmarking and whether there's any observations from that.
Your CEO is very competitive.
I am a little too.
We do joint reporting. So we do reporting through both the City of Toronto. We supply them reporting monthly, and then we meet with the City of Toronto and Toronto Community Housing to review the outcomes of that reporting. We also do benchmarking with the service manager directly. So our vacancy rate, our rental collection rate, our rent roll, we benchmark that for the year with the City of Toronto, and we meet with them monthly in order to ensure we're on target. And then in addition to that, we participate in the local housing network, in which we upload. I stole his thunder. Where we upload our results and send them into the Housing Services Corp. When that data actually gets amalgamated and put together, the 6 largest housing providers in the province, we do get very competitive, and we have made some excellent strides, and we lead the local housing network in various categories.
Yeah, I assumed that. It might be interesting at some point. I know that in some other work that I've done in healthcare, we've had anonymous reporting. Like, so you're not shouting out Hamilton or London or Toronto, but it would be interesting at some point to actually just verify for the board that, what we're seeing is actually the progress that I think that we are seeing, particularly I would say in the vacancy levels and the arrears. Reminding people that, OACH was set up for seniors, and, of concerns about seniors. Those are really important metrics at prevention of evictions. Tom?
Yeah, I just wanted to add through the chair that through the quarterly reporting, we do provide some of those benchmarks from the local housing corporation, the other housing providers. So you do see that. It's just not on this regular report, but quarterly, you will see that comparison.
Thank you. My memory must be off. Thank you. Yeah, so that's great. Well, congratulations on the work, but thank you also, Maureen. You've given them some more challenges in terms of some more data that we want, and good questions. Any other questions on the operational dashboard? Okay, so we'll accept that for information. Any other questions or comments as we wrap up the adjourn with 3 minutes to spare? Good work. I just want to, if I could have a motion to adjourn, somebody to pass. to move that? Maureen?
So, yeah.
Thank you, Fareed. Seconded by Maureen. All in favor?
Aye.
And thank you. And just before we go, I just want to thank you. I'm always reminded when these meetings are taking place that it takes a village, and we have a very strong village of team members that make sure that these meetings go ahead. And I think that it's great that we're working towards being a little bit more hybrid. And you know, I'm open to feedback from members of this committee if we want to actually have some more in person. But we'll also always give an opportunity to call in so that it's as accessible as possible. So with that, I wish you a wonderful rest of your summer, and I apologize for my early technology. It's good to have a phone and a computer operating, except that I have to see two of my faces. So I hope that everyone has a great summer, and thank you again. Have a great day.
Thanks. Thanks, Chair.
Thank you, Linda.
Okay.
Good evening,
Bye-bye,
everyone.
folks.
Bye.